on the NewsChannel 5 network. This is Open Line.
Hello, everyone. Welcome to Open Line. Thank you for being with us tonight. We are again talking about the coronavirus. And tonight, we're talking about why African Americans are at greater risk. We've seen this all across the country in the reports that are coming in. We've seen it here in Tennessee. We've seen it in other parts of the country where this has definitely been a major concern. We're happy to have with us tonight via Zoom, once again, social distancing. So we are doing our interview via Zoom. We are happy to have with us Dr. Bruce Randolph. He is the health officer of the Shelby County Department of Health. So Dr. Randolph, thank you for being with us.
Thank you for having me.
So you're coming to us all the way from Shelby County. And as we talk about this issue, what are you seeing there? What are you seeing in Shelby County with your cases of COVID-19?
Well, as of today, we have 1,432 cases of COVID-19, and we have 31 deaths. And we have tested a total of 15,082 people. Now, when we do a further analysis, we have managed to analyze about 900 of those cases. Matter of fact, 911 exactly. And it breaks down like this. 71% of our cases occur in blacks, and 23.8% in whites.
So 71% of your cases involve blacks, but only 54% of the population there in Shelby County is black. Is that right? Is that about a right number?
That's right. That's correct.
So why do you think we're seeing this? And again, we're seeing it all over, but let's talk about Shelby County right now. Why is there this huge disparity in Shelby County?
Well, it's because the disparity in health status mirrors the disparity in other aspects of life: social, political, educational, and economics. And so for me, to find this disparity is not surprising at all. It's really to be expected, because the overall health status of African Americans is less than that of white Americans. African Americans have a shorter life expectancy, have higher infant mortality rates, and die of preventable diseases as well as chronic diseases at a higher rate, particularly things like hypertension, diabetes, and even other chronic diseases. So it's not surprising that we see the disparity that exists in our society manifest in the health outcomes of this particular pandemic.
And are we saying right now, are you saying that more African Americans are getting the coronavirus, or more African Americans are dying from it? Or I guess both?
Well, both. We haven't performed recent analysis. Well, I'll take that back. Of those deaths that have occurred in Shelby County, you still get a high percentage of those deaths occurring among blacks, around 70% also. So yes, more are becoming infected, at least according to our data, and more are dying.
Can that be, I mean, there's been some discussion of is the African American community heeding some of the social distancing sort of warnings and that kind of thing. Do you think that's part of it, or is it more this greater disparity that you're talking about?
Well, I think it's multifactorial. And really, the thing that I would be interested in looking at, a couple of things. When we look at the cases, what part of the city are they occurring, or this county are they occurring in? Number two, when we look at those who are diagnosed with COVID-19, what percentage end up at the emergency room? And I would like to look at that demographically. And of those who end up in the emergency room, what percent, what is the demographic breakdown of those who end up getting admitted? And then what's the demographic breakdown of those who end up going to ICU and on ventilators as well? But, if you look in, you talk about social distancing, as I call it, safe separation of 6 feet. If you're living in a home that may be a 2-bedroom home with 1 bathroom, and there's 4 or 6 people living in it, it's very difficult to practice safe separation of social distancing. Also, the type of work that you do may not lend itself to the option of being able to work from home. Your job may be one that requires you to actually be present and be there in a situation where you're more likely exposed to the virus. So I think there are multiple factors. Certainly the underlying health status, whether it's obesity, hypertension, asthma, heart, lung disease, all of these factors that are often determined by a combination of things: lifestyle, behavior, the environment you live, the jobs you work,
I think this really does focus on all of those things. But one thing that is,
exactly,
it is interesting. We have only essential workers, only those deemed essential are working. But it's very interesting, who's deemed essential. And someone wrote in this article that I'm reading, the coronavirus crisis should make everyone aware of the plight of African Americans who clean their homes, pack their boxes, pick up their garbage, and ring up their groceries, and who do all the essential tasks to everyone else's ease and survival. And so, again, I think that kind of fits into the point you're making, that many of these jobs that are deemed essential often are lower paying jobs, and they're putting people at risk, while other people do work from home and aren't putting themselves at risk as much. What do you think about that statement I read?
I would agree with it. And even those who are working from home may be working for a business that's classified as essential, but because of their job title or their particular job position, it's one that, again, they're the CEOs, the directors or managers, and so they can sit at home and work at the computer. Whereas someone who's having to do more of the common labor work, so to speak, the cleaning, the pushing, the pulling, or whatever, are not granted that opportunity.
Yeah, and it's the job we have. Then there's also in this article, and I'm going to quote the article appropriately. I'm not sure. I'm sorry. I'm reading this article, and I'll quote it. I believe it was in the Shelby County paper or the Memphis paper, but it talks about African Americans, and again, these are broad generalities, and I just want to get your opinion. They're suspect in some ways, I guess, of health care. Maybe they don't have the doctor-patient relationship that others have. What is that something that you see? Is that true? I guess they don't have access to health care. Are they sometimes even suspect of doctors and health care and that kind of thing, or what do you think?
Well, I think that it's well documented that there's been disparities in the treatment that African Americans have received compared to other groups. I think that's been well documented from two patients coming in with the same complaint of pain, receiving different treatments as it relates to pain medication. So I think that, yes, there's bias in medicine and has been that way for years. And so I think that people have some skepticism, should I say. And I would say that it's because also the history that have taken place historically, dating back from slavery on up, that even in my lifetime, I'm old enough to remember going to separate waiting rooms. And that was one of my motivations for going into medicine, when I thought about the fact that the times when I sat in the separate waiting room and had to wait till all the white patients were seen before I was seen. So folks still have that experience in the back of their mind and their history. So they're not trusting of the system in many instances. So subsequently, you go if you're in pain or bleeding, but any other reason, you may not necessarily go and seek care. If you do, you do it with some hesitancy or some lack of confidence. But also, what that speaks to is the need of why it is important that you have diversity in medicine and in all fields. That's the importance of the whole issue of what we call cultural competency, and realize that, in order to communicate with the person, you have to be able to connect with them in some form or fashion, and have some respect for who they are, their culture, and even their belief systems. And so it's my understanding that there now is a greater emphasis on trying to teach young doctors the importance of having an appreciation for cultural diversity.
So,
understand, don't think like.
Yes. And so, all right, you're there in Memphis. You're there on the ground in Shelby County. Everyone is interested in, flattening the curve, when we're going to start turning the corner on this. And that, in Shelby County there, where are you right now? Are cases going up? Are you beginning to see things level off? Where are you now? Where do you think you'll be in a week, in 10 days?
Our cases are continuing to go up. They're not going up as fast, but we're still having increases. And so we're not yet at a plateau. It's been projected for us that we may not reach our surge until mid or late May, or possibly 1st of June.
And how concerned are you by that?
Well, I'm very concerned in the sense that one, I think that we are prepared in terms of the availability of beds and ventilators and healthcare resources. My greater concern is whether or not the people will continue to tolerate the stay-at-home and social distancing measures, especially when we look at the economic effect that it's having. So my concern is that the pressure would mount, that the leaders would feel necessary to prematurely discontinue these efforts, because it boils down to a situation where people are no longer tolerating it.
When you say that the peak might not happen until late May, early June, I could see why you might be concerned. I think people might be very restless. And so Are you sensing that among leaders there? Are you sensing that among people? I mean, I would, it's not a shock.
I think, sort of in keeping with the ideas of when can we open up the economy again. And so there's already talk from the president on down, right, that, hey, we really need to look at how we can loosen up and sort of open up our economy once again.
And do you think we could open up rural areas and keep cities, I guess loosen some of the restrictions in some of the more rural areas, and then in cities like, I guess, Davidson County here, Nashville, and certainly in Memphis? Does that work, to open up some areas and keep restrictions on other areas?
Well, I think we need to let the data sort of dictate to us how we should go about doing it. For example, businesses that does not necessarily present a increased threat of transmission of the virus. Businesses where you could practice safe separation, social distancing, businesses where you can avoid crowding and gathering. Those businesses may be allowed to operate in some form of fashion. I don't think that we will go back to the crowds and the type of gatherings that we had prior to this for a while. And I think also testing is going to be a very important factor, because we need to test to see what we're really dealing with and how bad of the situation, how many people are infected, and can we identify those who are infected and separate them from those who are not, and those who are infected, can we identify those who they may have come in contact with and do the contact tracing is necessary and put them in quarantine and monitor. So I think it's a combination of things that will come into play to govern how we go about opening up society and the economy. I don't think it's going to just be, okay, everybody go back to doing what you used to do, everything is over. I think it's going to be a gradual thing based on the data and the evidence.
All right. We are talking with Dr. Bruce Randolph, health officer of the Shelby County Department of Health. We're talking about why are African Americans at greater risk for COVID-19, for the coronavirus. We're going to take a break. Open up the phone lines. That kind of sets the table for the discussion. We covered a lot there. But give us a call if you want to call in. You have a question or comment. The number is 615-737-PLUS. 615-737-7517. Take a break. Be back right after this.